At first, Bill 20 had nothing to do with gaming machines and everything to do with paying off the hospital's vendors. In fact, the very first version would have taxed health insurance companies to pay off the vendors, and during a public hearing on March 3rd, Hospital Administrator Joseph Verga and vendors even testified in favor of the measure.
Because of the debt of the hospital, we are on we have a very small credit limit, especially from preferred vendors where we receive services and critical supplies at the most cost-effective rate. We're also in debt to a group of 20 or more physicians that have received that provide services at the hospital. Many physicians have not been paid for a very long time.
I must say that in the more than 25 years that I have directly managed our small family-owned business, I have seen our accounts receivable from GMH grow from $50,000 way back in 1987 to more than $1.2 million presently.
But this first version of Bill 20 was vehemently opposed by insurance companies, so Senator Dennis Rodriguez Jr. replaced it with a substitute version that would instead tax gaming devices like Liberty machines.
We got the insurance industry, of course, who came out and really scared the community, saying that they would have to pass this down to them, which I still believe today shouldn't be the case. You know, they get very huge, generous qualifying certificates, and I believe they can absorb the costs. So the the substitute version that I have now looks at a different funding source, which is the recently licensed gaming machines.
Again, a public hearing was held for the second version of Bill 20. And again, both Verga and hospital vendors came out in full support, saying the tax on gaming machines was necessary to pay off hospital debts.
Every day that goes by, the interest on the debt increases. It puts more pressure on the hospital, and more vendors will not do business with us because of it.
We, the GMH vendors, especially local vendors, are extremely frustrated trying to collect from GMH. This is a liability that GMH, the government of Guam, and this legislature cannot continue to ignore.
But during session this Monday, Senator Dennis Rodriguez Jr. put parts of his Bill 20 into Senator Chris Duenas' Bill 19. But the parts that got put into Bill 19 now have nothing to do with the paying of hospital vendors.
We can't say Bill 20 was put into Bill 19. Provisions of Bill 20 were put in as a floor amendment.
8% tax on the gaming devices. What do the proceeds go towards?
60% to the funding the urgent care operations, and then 40% is just as I said earlier. We listed, it's prescribed what it's used for, but still must go through legislative appropriation.
So now, the version of the gaming bill that was passed by lawmakers unanimously on Monday has nothing to do with paying hospital vendors, and instead has to do with taxing gaming machines to fund the urgent care center at the hospital. Even though in the legislative intent section of the bill itself, it states clearly that it is the intent of the legislature in Guahan that the first priority in the expenditure of fund monies will be to extinguish the existing hospital debt.